right, I'm gonna do an Ezpap. So the first thing I'm gonna do is check the patient's charts to see if they had any nebulizer treatments, because this can be coincide with the nebulizer treatment and can go along with it. So if I need to take a TPs to adapt with the Ezpap. So when I'm ready, I'll knock on the door, introduce myself, wash my hands, check the patient ID band, and then I'll assess the patient before I do a treatment. So I'll listen to their lungs, and then I will get their vital signs. So when I'm ready, here I have an Ezpap. So here's the little device. It's not very big. So when we instruct the patient, we're going to instruct them not to cover the NPs, as that can occlude the treatment. Every Ezpap comes with a disposable manometer. So what we're going to do is we'll place it on here. We'll take off the cap. There's two different open ports that we will connect, that we can connect things to here. We'll connect it to the smallest one here. And so with this, we'll turn it to where we can read it when they do it, their treatment. That way we can see where they're at. And so with the Ezpap, it has to be connected to an oxygen source to work properly. So when you're ready, we'll get this all opened up here, and we will connect it to your piece. So we'll connect it here, and then we need to make sure it's connected tightly. That way it doesn't pop off when you turn it on. And so the starting flow, you'll start it at 5 liters per minute. So you'll tell the patient, kind of tell them what it's going to be. So this is an Ezpap. So this is going to open up your lungs, and this will help you be able to cough and strengthen your lungs to cough up any secretions that you may have. And this will be a little easier treatment for you. That way you're not having to work so much with it. You just take a nice deep breath in and out when you do this. And I'll do it along with you to demonstrate. So you'll place it under here, and then we'll turn it up to 5 liters per minute. And then you'll demonstrate and show them. Okay, so when you hold it, I'll have you hold it like this. I don't want you to occlude the end piece like that. And you don't want it to be upside down. You want it up so that way we can read the meter, and that way they get the appropriate flow. And so they can either have a mouthpiece, and there even can be a mask that can be connected to this to help them when they do it. So we're going to do it with a 1 to 3, 1 to 4 ratio. So we're going to have them do a nice deep breath, then exhale. And you want to have a nice forceful exhale, but not too strong. Just enough to kind of get their lungs open enough when they do it. So we'll watch a meter, and we'll see where they're at, and then we'll chart down how far they got with it. And so when you're done with this and they're done doing their treatment, you'll have them do it a few times, and then you always give them a rest when they're doing this. But this is a disposable one, so you would remove that and dispose of it. And then if they just need it without it, then you would cover this port so you don't have any excess air flow. That way it closes it off. And then if you have a nebulizer treatment that they would like to go along, doctor wants to go along with it, then you connect it on the mouthpiece, and then there would be a little medicine cup at the bottom to connect the nebulizer medication to. So when you're done, you'll shut this off, remove it from your oxygen source, remove it from your device, set the device to air dry, instruct the patient not to wash it with any water or anything. You need to let it air dry. And so this, you just wrap it up like this. That way it is set in the appropriate area like that, in a safe area, so that way they can do the treatment again. So we'll have to do it every hour or so, just depending on what the doctor would like them to do. And so you'll go and reassess a patient after you wash your hands, and you'll listen to their lungs and check their vital signs. And if they coughed up anything, you need to make sure you chart down anything that they coughed up. And then always, like with these treatments, you need to have them do a nice deep cough. So when I'm done, I'll go wash my hands and chart everything on the patient's chart to let the doctor know what I have done.